So this is the implant that we have designed and 3D printed ourselves here at the hospital. It now resides in the patient.
It has big advantages for the patients to be operated on with this kind of method. The implant matches perfectly with the defect, or it did in this first operation at least. And the operation time was shorter than it would have been otherwise, and that decreases the risk for infection. My name is Bryndís Baldvinsdóttir and I'm a neurosurgeon at the neurosurgical department in Lund.
The main advantages is that we can produce our implants faster and that we can produce them patient specifically, so every patient gets their implant that is fitted to them, and this also leads to less complications during surgery. My name is Philip Bernborg and I am a biomedical engineer at the 3D Centrum here at SkåneUniversityHospital.
The biggest advantages is that we can be involved in the whole process from designing the implant until it's ready in the OR.
So we get our data from CT images, which is a collection of X-ray images, and then we can design and 3D print the implant here at the hospital. That then goes off to the sterilization central for sterilization.
My name is Peter Sisch. I'm a neurosurgeon at the SkåneUniversityHospital in Lund, Sweden. This is, to our knowledge, the first time ever in the world where the hospital can manufacture, test and implant a cranioplasty.